So what is the psychological component of dealing with the addiction process? We said that there was a post-traumatic stress disorder which really started off the addiction process initially. Once the Suboxone is in the picture, the post-traumatic stress disorder still has to be dealt with. So we have a system we call Step 13, which starts to deal with the post-traumatic stress disorder. So how does that go? Our thought process is, because of the trauma, there is what we call a core myth, a negative belief one has about himself that results from that trauma. So if a woman was sexually abused, she feels worthless or unlovable, or a huge loss, someone died, then the core myth might be underneath it all, I'm basically doomed. But whatever the trauma was, there's an idea that comes from the trauma that follows the person for the rest of his life, unless he gets into a therapeutic process and basically takes the control out of the hands of this particular myth. So the Step 13 approach now takes a look at the early life trauma, number one, and that it forms a myth, a core myth, and that myth has to be identified because a person's decisions and choices all revolve around the myth, actually covering up the myth. So let's start at that point and see where we go from here.